Hi, I'm Nick Markey, the Beach Barbell in Wilmington. This is the Beach Barbell Podcast and Videocast. Today we're going to talk about what's the deal with low back pain. Low back pain is probably one of the top complaints people go to a medical provider for. It is, as far as I remember, the probably number one musculoskeletal complaint, so that means the muscles in the bone. To maybe the emergency department or primary care doctors. And the cost annually is quite high, I know, in the several billions of dollars in terms of care for low back pain. So what I want to do is just talk about some various factors regarding it that may help you. So let's start with maybe some myths about low back pain. So the back, people refer to the back, involves your spine, the bones that stack up on top of each other, the spinal cord, which runs inside open holes in the spinal cord. You have various ligaments that attach the bones to each other, and then you have various muscles surrounding the back in various ways. Some that run sort of up and down the spine, some that kind of wrap around, some that cross diagonally. So lots of different directions of muscles. Oftentimes this may be referred to as the core. So the top myth is that if you have a herniated disc, you will feel pain. And how we know this is a myth is that when they do large studies of several thousands of people and they scan all their backs and also ask them how, if they have pain and what their function is, something like 40 to 60% of those people end up having herniated discs but have no pain and no issues with their activities. So that still leaves, maybe 50-50 that do potentially have pain from a herniated disc, but it's not a certainty. The one thing with the herniated discs is that part of it just might be a gradual change in that person's structure that their body adapts to and doesn't make an issue of, and they just continue on with life. And maybe for other people, that change may happen quicker than the body is able to adapt to and react to, so then perhaps that could initiate a pain experience, but it's not certain. The likelihood of the herniated disc causing issues is more relevant when the person's having maybe more neurological symptoms, perhaps going down the leg, maybe having numbness in a part of their leg, or weakness in a very specific area. And then that leads to a guess that maybe this particular nerve root, because each nerve root corresponds to relatively similar areas in people. And so then if they do the MRI and it seems that that nerve root is affected, then that is more likely case. But they started with the clinical analysis, so talking to the person and assessment of the area and what's going on, and then you confirm it with the MRI, not let's go do an MRI and then try to figure out what's going on, because you're going to see a lot of stuff that may have nothing to do with the case, and perhaps, as we've talked about before, may unnecessarily scare somebody, which, if we go back to our discussion of pain being threat, that could raise the threat level of the situation and perhaps increase the pain and suffering of said person. And then if that is linked to them also becoming less active in their life, then we start to go down a negative cycle where they start to lose function, start to lose confidence, start to head towards potential depression and other things that are not a pleasant thing to live with. So there's also arthritis. They oftentimes is referred to as degenerative disc disease. Very scary sounding name for arthritis. Again, another function of aging. I heard someone refer to it as just gray hairs and wrinkling on the inside. Again, arthritis is a gradual process and a common one for basically every person. Certainly some people get it sooner than others, and some people are symptomatic with it and some aren't. With the back, it's not so clear. So in those same kind of studies where they do the scans and ask people, they also find something like 50 to 60% have arthritis in their spine and don't have any issues. So there are some that may have, and there are some that may not. So it's not so clear. Because then there's people that in those same scans have pretty good looking backs on the scans, but they may have pain. So then it's not clear what's going on with those, right? So those are some of the top myths. I think another myth that is important to address is core strength. It's not so clear what that really means because we don't really have a clear assessment of what even the core is. Some people think it's just the inner abdominal muscles. Some people think it's all the abdominal muscles. Some people include the glute muscles. Some people then include up into the upper parts of the trunk. So there's really no consensus on what the core is. And also not a great assessment of what actually the core is. Now we have assessments in terms of certain abdominal tests, abdominal strength and back extensor strength, and certainly you can really test all the angles. You can test the trunk lateral flexion strength, that's kind of tilting side to side. You can test rotation strength, so you could test all those strengths, but to relate them to what core strength is not so clear. Oftentimes what people might be referring to when they say core stability, they might be referring to the ability for someone to maybe hold a position, and then for certain things this could be positive. So if I'm doing maybe a barbell back squat where I want my back to kind of hold pretty strong and in a stable position, then yeah, sure. But the reality is when they study the spine in something like a barbell back squat or a deadlift, there is still bending going on in the spine. No matter how much it looks like the person's holding it, perfectly straight and tight, it's still bending a little bit. So again, not so clear. The evidence also isn't so clear that core stability or core training is superior to any other type of training for low back pain. So what the broad consensus seems to be is that exercise in general, it can be helpful for low back pain, but it doesn't really specify what kind. When they studied all sorts of different types of training, core stability, motor control, that's similar to like core stability exercises, strength training type exercises like deadlifts and squats and that kind of thing, Pilates, yoga, just walking, aquatic therapy, they all kind of run about the same. So it could be more just that the person should be active and you just need to find what makes sense for them. What do they tolerate? What do they like? And what's something that they're probably going to continue doing for longer periods of time? Because if you're making them do core stability exercises and they hate them, then likely they're not going to continue doing them. But if you're doing core stability exercises and they really like them and they feel good and they enjoy it, and then maybe that is something that's good and reasonable for them. So I think the main thing would be more from a clinical standpoint, assessing perhaps all the different angles that the back, uses, try to figure out which ones need improvement and, which ones are tolerable. And then from there, initiate a program to maybe address those specific impairments. And I think most therapists are pretty good at this, but I think sometimes we get a little obsessed on just core stability. So I think that's probably enough for myths for right now. I'm sure there's other ones, but I think those are the top ones I could think of. So we mentioned aging and genetics a little bit. So with arthritis, arthritis does seem to be highly affected by genetics. Now, there are certainly traumatic injuries that can certainly enhance arthritis, make it happen sooner. But for majority of the population, arthritis is most likely a genetic component. That's why some people can get, hip arthritis in their 40s, and then some people might not get it until their 90s. And so in the back, arthritis seems to start, from our long-term data, the arthritis seems to start, in your 20s and 30s. So in reality, it's starting pretty early in our lifespan as our life longevity is right now. For men, 70s and 80s, sometimes 90s. Women probably 80s to 90s. But doesn't necessarily mean someone's having pain with the situation. So you can't really change the aging factor yet, right? Unfortunately, and we can't really change your genetics. So there's really not a whole lot you could do there besides just not worrying about it a whole lot. And this kind of goes back to the scans and us being responsible clinicians and not over scanning and frankly just scaring people so that they don't keep living a life that's full of enjoyment and activity. And especially since our society is becoming less and less active in younger and younger decades, then we should do our very best to minimize scaring people from activity and scaring them about things going on in their body. Focusing more on encouragement and what you can do than focusing on all the negative aspects to it. So not a whole lot more we could talk about arthritis, but I did think of one thing. Think about how long a dog lives for, something like 10 to 15 years, right? And, some dogs get arthritis in their hips. They're just a little slower to get up, and then they start moving, and then, they move a little bit better, kind of just like a human with sometimes arthritis, right? You get your kind of stiff when you first get up, and then you move, and it kind of warms up, and you loosen up, right? So a dog getting arthritis at 10 years old, it's only been on the earth 10 years. Do we usually associate a 10-year-old child with arthritis? I mean, they've been on the earth just as long, so they've had just as much gravity. And you might even argue more so because it's all going through their hips, whereas a dog has it distributed through the front paws as well. So again, it kind of leads to that genetic side because a dog's lifespan is much shorter than ours. Its lifespan is a little bit different. So its genetics dictate something a little bit different, just like a human. A human child at 10 is probably not going to have arthritis. So just some food for thought. Another thought that's probably important and dovetails with all these things we're talking about so far is, can you exercise with low back pain? Absolutely. Now, we've talked about kind of my rubric for deciding if you should or shouldn't do certain things, but obviously you have certain activities that you like to do, maybe certain exercises that you like to do. The best thing you can do is try them at maybe an easier level or shorter duration, see how it reacts to that, maybe take a break, try it again for a short bit, and then maybe wait for the next day and see how it affects you for the next maybe 24 to 48 hours. And if you're feeling like you're not feeling too bad after that, then maybe you approach that activity again at a slightly higher level or a little longer duration. Does one single exercise matter more than others? Probably not. Now, I'm biased towards resistance training because of its other health effects, but certainly if someone's just trying to exercise to help their low back pain, then they have lots of options. And again, it comes back to that choosing something that you actually enjoy and you actually will do. That's the best exercise, is the one that you'll actually do. So if it hurts too much, you're probably not going to do it. If it's boring, you're probably not going to continue doing it. So find the ones that you like to do and try it out, small levels at first, and then over time gradually build up. Start small and build slow. With time, your body will become more tolerant to it, and if you start to notice one irritates you, then push it aside or make it easier or go do a different thing. No one single thing you should feel beholden to. Experiment a little. And this is where maybe having a clinician may be helpful, where they can assess you and kind of see which angles seem to be tougher than others, and then you guys can practice some things together. There's also the context in those kind of situations. Oftentimes I'll find someone will tell me about, lots of different moves and exercises that are painful, and then we try them together, easy at first, and then if they're doing good, we'll kind of bump them up a little bit. And sometimes they feel a lot better just because they're doing it around me, and that's not magic, it's just the context is different. They're, working with an expert. I put scare quotes on there. And how their body perceives threat, they may just feel safer. They're in a safer zone. So that's one positive when you work with somebody, and it doesn't necessarily have to always be a clinician. It could be, just your trainer. Maybe if you have a trainer that you trust and isn't just pushing you too hard, then that could be another good avenue as well. It could even be a good friend, a really positive, supportive friend who's not, just trying to push you into a bunch of crazy stuff, but, working with you little by little. So lots of different avenues for there. So moving forward, ultimately, all this, myth busting and, talking, what does it really mean? So the fact is that low back pain is just one aspect to your life. It's not your whole life. It is an important part of your life, and we shouldn't just ignore it like it doesn't exist, but it's just one variable in your life. There's also your health, your organs, your brain, your thinking, there's lots of other parts to you, your social life. Ultimately, you might have to rebalance things because of the low back pain, but it still doesn't mean you should, let it take over, because that's where people start to fall into isolation, depression, just all sorts of negative things that increase the suffering for this person. So when you're just thinking of just quality of life, find some activities you like to do, whatever it is. It could be just you go and play poker with people, or play bridge, or go for walks in the park. Find something that you're out there with, in the world, experiencing the world, experiencing people you enjoy being around. And then find some exercises that you like to do. And that could be something at the gym. It could be getting in the pool, doing stuff. It could be lifting weights, it could be Pilates, yoga, whatever. It doesn't matter a whole lot, as long as it's something that that you find enjoyable and sustainable in your life. So that is probably the best advice you can get is, don't worry so much about what's going on in those pictures that they show you, because remember, those pictures, those MRIs and X-rays, those are read by human beings. Human beings make mistakes, and sometimes clinicians don't think about the words they use, and I think I'm going to do another podcast more specifically on the words we use. So focus on what matters in your life, and then from there figure out how you can wiggle free to more things that you enjoy. And just sometimes there's going to be setbacks. Sometimes you're going to have to lay off or back off or rest more, and that's okay. But constantly look for how to keep enjoying your life. That's the main thing. Enjoy your life. That's going to be the thing that's going to increase your quality of life the most. Certainly there's lots of treatments and stuff that may be also helpful too, so I'm not downplaying any of that, but ultimately it's going to be up to you to create the life that you want to enjoy. So I hope this may have been helpful for you. If it is, please share it and reach out to me with any comments. I'd love to hear from you. And I think we'll go ahead and sign off and we'll post it up. All right, thank you for listening or watching. Bye.